So I loved my time at Lowery Woodall. It was definitely very neat to see the procedures being performed on such young ages. I only got to watch some colonoscopy and endoscopies. And so I kind of was expecting to watch tonsillectomies, and like I knew that those were performed at younger ages, but I don't know why my mind just thought that like colonoscopies and endoscopies were performed on like 50 to 60-year-olds for like the routine checkup for cancer. So anyways, to start with the discussion, I got to watch 5 procedures, and all of them were pediatric cases of colonoscopies or endoscopies. And I think the first 3 stuck out to me the most because it was the first time I was like being exposed to like reactions and just like what anesthesia like does to the kids. And so the first one was a 4-year-old boy who came in, and they all came in with similar like cases of just blood in the stool and constipation. So the first one was a 4-year-old boy who came in with chronic constipation and blood in the stools, and his procedure ended up having to be stopped and rescheduled because of the lack of preparation of bowel cleansing the night before. So Dr. Scrooge knew that the parents reported it to Dr. Scrooge that the night before the patient was like not very compliant to like wanting to take the bowel cleansing preparation, so they kind of like didn't force it on him because he was 4 years old. And so whenever Dr. Scrooge like started the procedure, he just saw that there was like just too much stool in the colon, and so he just had to stop the procedure because there was no need to like keep the patient under and like doing this procedure that was invasive, because there was like nothing that he's going to be able to get out of the visualization. So even though there was no complications of like bleeding and any of like that, definitely some additional education to the parents regarding like proper bowel preparation was very needed, because if not, like the new scheduled colonoscopy could like result in the same canceling or just like stopping during because of the inadequacy. The next one was a 9-year-old girl, but she went under a colonoscopy and an endoscopy, and she was a complete turnaround from the first patient. The first patient was very like compliant and just kind of was like sleeping the whole time during like pre-op, and then like getting them under anesthesia. So there was very high compliancy with the 4-year-olds, but with this 9-year-old in pre-op, she was like jumping on the bed, and like she wanted to be carried from like pre-op to like intra-op and into like the surgical room. She was like talking to everyone and just being like very rowdy, but just being very sweet. And so she loved the game of like trying to pop the balloon with the oxygen supply. She wanted to pop the balloon and get the confetti out. So she loved that part that the nurses like integrated for her. But whenever it came to like actually the anesthesia was kicking in, she became like very, very anxious and combative, and she started kicking and moving, and so the nurses had to like hold her down to safely administer the anesthesia. But once sedated, the procedure went smoothly with no complications. And the last patient was a 10-year-old boy who had a colonoscopy and endoscopy. And just similarly to the previous patient, was very like sweet and like didn't really seem like he would be combative under anesthesia, but he was very combative. He was probably the most combative out of the 3 of them whenever it came to anesthesia. So yeah, but with him, I actually got to observe him pre-op, intra-op, and post-op, and in the recovery room, it kind of like the combativeness followed him into like recovery, and so he just tried to like take his gown off, and like he only had his briefs, his undergarments on, but he was just trying to like, he kept like repositioning, and it seemed like he was gonna fall off the stretcher. So I did get to see how like calmly the nurses like acted towards the patients, and especially the kids whenever it came to recovery, with her just like using her nursing interventions of like reorienting him to like wake up, and that like he was okay because he kept asking for his mom, And he just like looked very confused and like was just not aware of like his surroundings at all. So she just tried to like make sure he was like not gonna fall off the stretcher, or like that he kept his gown on, and like provided reassurance of like, oh, like, okay, like, are you ready to go see mom? And like whenever she was saying stuff like that, he definitely calmed down a little bit more. Two things that I would teach regarding the discharge instructions, since all the kids were around the same age, and like all had the same procedures done, I would definitely emphasize diet, hydration, and then also warning signs and activity restrictions. I would let them know that preventing dehydration is like key. So to start with clear liquids and advance the child's diet as tolerated, but watch for signs of fever and severe abdominal pain and persistent vomiting or blood in the stools, and contact the provider if any of those occur. And then I really did love my time at Lowery Woodall. During the experience, I was able to observe that pediatric surgical nursing requires a lot of patience and adaptability, because you do not know what your patient's reaction is going to be to, especially the anesthesia. So I watched like the nurses all remain calm and we're all reassuring, while also like maintaining the safety of the children, because like especially the anesthesia was the most problematic part that I saw. And yeah,